Thank you very much for joining us. I'm State Senator Jennifer Schilling. I am pleased to be joined today with folks from Citizen Action, concerned healthcare professionals in our state, and my good colleagues in both the Assembly and the Senate. We are here today because as we start our fall floor period, there is a call to action. That call to action is to revisit the issue on Badger care and health care in this state for citizens of Wisconsin. So today I am pleased to be joined by my colleagues who will talk about the efforts that we have been doing to move forward with an urgency for our legislative colleagues and for Governor Walker to do the right thing when it comes to access to health care for Wisconsin citizens. I will turn it over now to Senator Janet Bewley.
Good morning, and thank you all for being here today. We have good news. The good news is that Governor Walker's decision to end his campaign changes our political reality, and it gives my Republican colleagues the opportunity to undo the damage that was done here at home while he was campaigning. The bad news is that there's plenty of damage to undo. Job one is to undo the governor's decision that leaves 360 million Wisconsin dollars in Washington for no reason other than partisan politics. That's why my Democratic colleagues and I wrote to the Senate Majority Leader last week. It's time to bring those dollars home. Today I am proud to be joined by advocates and people from across the state to drive home the point that it's time to do the right thing. Wisconsin taxpayers were left with a deep budget hole, damaging and thoughtless cuts to our University of Wisconsin system, our beloved extension, and at least 85,000 deserving Wisconsinites were left without Badger care. 3 Republican states have brought these dollars home just this year alone. One of the Republican governors who is right now on the presidential campaign trail correctly points out that this is the money of the people of his state. Governor Walker's presidential run was never a good enough reason to leave these dollars, and most importantly, these families behind. 5.8 million Wisconsinites should be able to count on their own governor to do the right thing. Today, it's time to stop wreaking havoc, put Wisconsinites first, and do the right thing. Now it's time to hear from Citizens Action. Thank you.
Thank you very much, Senator. My name is Robert Cray. I'm Executive Director of Citizen Action of Wisconsin, and I'm also joined by constituent citizens across the state who couldn't be here today but signed 40,000 petitions asking for Wisconsin to take the money and to accept the money for Badger care. And so not everyone can come in the middle of a work day, make their way to Madison, but this is all behind it. There's really no political demand to turn down the money from the people of Wisconsin. It was another kind of politics. And the reason we think that this can be changed, quite frankly, is because this was arguably the worst budget decision in Wisconsin history. We are literally paying nearly $400 million more to cover fewer people. And so the result is they have a number of people who do not have as affordable health care. They have health insurance that was not designed for them at their income level, and therefore they have trouble affording and may be uninsured as a result, or are struggling to pay their medical bills and their other bills and make ends meet. And in addition, you're forcing massive cuts to our education system, our K-12 system, other major cuts that are entirely unnecessary, that are entirely self-inflicted wounds. And so that's why I say this is a terrible budget decision, and it's getting worse and worse, and that's why this will become more and more of a fiscal crisis as we move through this biennium into the next biennium. The reason for that is our failed economic development policies. We are replacing the middle-class jobs we lost during the Great Recession. We're still losing them, mostly with low-income jobs, and that means eligibility for Badger care is going up. And as a result, that's why the Fiscal Bureau once in a while keeps increasing the cost, the estimate of how much this decision is costing us, because there are more and more people who work at the Walmarts, the Kmarts, and the service and retail sector who are on Badger care and who we are not getting the full federal money we could get because we have turned down this extra money for Badger care. And so this becomes more and more costly every single day we wait. So our hope is this, that now that the political reason for doing this is gone, because there's no good public policy reason, this only could be politics. Now that the political reason is gone, Governor Walker and the majority in both houses has a very strong incentive to do the right thing, follow all of the other Republican governors and legislatures that have already taken the money, and take our fair share of money and make sure that we have as many people as possible having access to affordable health coverage, which is a necessity in the 21st century. You don't have access to the American dream without affordable health coverage anymore. And then also deal with a lot of pain in this budget and budgets moving forward that is entirely unnecessary. So with that, I want to turn it over to someone who has been working hard on this issue, Representative Daniel Reamer. So, thanks, Robert.
Thank you, Robert. Thanks to the press corps for being here. Thanks to my colleagues, members of the community, members from the health profession, and tens of thousands of folks across the state of Wisconsin who made it clear that they want our tax dollars to come back to the state of Wisconsin to help people get access to affordable health coverage. As Robert mentioned, my name is Daniel Reamer. I'm a state representative from the 7th Assembly District. Now that Governor Walker has quit his bid for the Republican presidential nomination, it is time for Wisconsin's governor to quit his politically motivated rejection of our tax dollars to strengthen Badger Care right here in Wisconsin. The tens of thousands of Wisconsinites who would gain coverage are working people. They're just above the poverty line, but not nearly in the middle class, and they would benefit the most from this acceptance of our tax dollars to strengthen Badger Care. This would also benefit the entire state by freeing up hundreds of millions of our tax dollars to strengthen our schools, invest in our infrastructure, and provide tax relief for working families. If you're like me, you watched the game last night and probably were as impressed as I was with Aaron Rodgers' stats. He threw for 333 yards, 5 touchdowns. The stats on this bill are just as good, just as impressive. It would save the state $360 million, according to the Legislative Fiscal Bureau. So even more than the initial estimate over the next biennium alone, potentially billions of dollars over the next several years. It would also help 85,000 people gain health coverage. Again, those are the folks who are just above the poverty line, but below 133% of that line. When you put up stats that good, you tend to win the game. And this bill, this expansion of Medicaid coverage, this strengthening of our Badger Care program, would be a serious win for the state of Wisconsin. It's time for Governor Walker to do the right thing. Thank you.
No, we'd all be happy to take any questions. I'd like to thank all the people that came here today, including my colleagues, Representative Kolsky, who's the ranking member in the Health Committee, one of our leaders in our caucus, Representative Joe Costa-Zamaripa, and Representative Lisa Subik, who also has been working very hard on this issue, and all the citizens who are here as well. Thank you so much for being here. We'd be happy to take any questions that you might have. Not,
Peter, do you think you'll get a different answer from Governor Walker?
well, you know, let me say this. Look, let me say one thing, and then I'll turn it over to my colleague. Look, you know, his whole approach was he wanted to be the most right-wing governor, and he thought that element of his party would propel him to the White House. But the results speak volumes. At the end of the day, he had a 0.5% of his party that supports him. Meanwhile, governors like Governor Kasich, who did take the Medicaid money, is doing significantly better than him. So I think he has to take some stock and say, this approach is not working. His popularity in the state of Wisconsin is at 39%, the lowest he's been at, one of the lower levels of approval any governor's had. And so as a consequence, I would hope he would take a step back and say, you know, the approach I've taken, which is to have polarizing policies, to take a far right-wing ideological approach, which is the only reason for not taking this money. And maybe I need to do something a little bit differently. So that's our hope. That's why we're here today. That's why Citizens Action, they work so hard to get all of these petitions signed, and so many citizens are here. But you wanted to say something as well?
Just, I imagine like all the folks in the press corps and many people at home, if you followed Scott Walker as he was on the campaign trail, you know that if you ask him one thing on Monday, he says one thing. If you ask him another thing on Wednesday, he might say the opposite thing. If you ask him something on Friday about the same issue, he might say something completely different. So I hope you ask him. We sincerely hope that he'll change his mind and do the right thing.
Whether or not there's electoral pressure on the governor, there's another election coming next year, and seemingly it'll be another referendum on Obamacare, on the ACA. Do you think there's any way to affect change between now and next year's election?
Well, that's where, we hope that we receive the calls in our offices. Citizens contact us. They want this. I mean, our agenda is so different than the Republican agenda. The agenda we put forward is what we hear from citizens throughout the state, whether we're out at events, whether you're knocking at doors. They want health care. They want meaningful, positive, effective education. They want infrastructure to be built. The Republicans' approach is to do things that nobody's asking for, John Doe reform, GAB, things that we don't hear from one single citizen. This is something that is meaningful. It's important for people's health care. It's important for people's lives. It's important economically. It's one of the more important things we could do this session. And while the governor's not on the ballot, Republican legislators are. Now, I understand they want to protect their governor who was running for president because he thought he was going to be president on this right-wing ideology. But when they see his approval rating at 39%, I'm hoping they're going to take a second look and say, maybe we ought to start doing something a little bit different around here. So that's our hope, and I hope that all the various medical groups, every single medical group that has weighed in on this issue has weighed in favor of accepting the Badger Care dollars. So that's what we're hoping.
Let me say one additional thing since you brought up ACA, and that is, look, the whole situation has changed around the Affordable Care Act. With the second Supreme Court decision, the public's ready to turn the page, and they want us to move forward and not debate the fight from 5 years ago on passage. And so even people, we did focus groups around the state on this, even people who didn't like the Affordable Care Act at first are saying it's time to end the partisan bickering and just improve our healthcare system. And so this is one of the last legacies we have in Wisconsin of this, that is the refusal to take the Medicaid money. Most people, even if they differed on the Affordable Care Act, think it's time just to do everything we can to improve the system, make it more cost effective, cover as many people as possible. So I think and you'll see it in the presidential race, Governor Walker tried to get a lot of play out of being the only one with a full plan to replace the Affordable Care Act. It got no traction whatsoever. It's barely being talked about in the Republican debates. So it's important to understand the changing landscape of the whole issue of the Affordable Care Act when thinking about the issue of taking this Medicaid money.
Today we may get the Knutson's GAB bill. We've got a little more than a year until the 2016 election. Do you lawmakers feel that there's enough time to implement that change and implement the election effectively?
Well, I would say this. Look, first of all, we think it's preposterous that they're even proposing this. I don't hear one citizen in this state say, Peter, what would really make the state stronger is if we would get rid of GAB and nonpartisan judges and bring in partisan officials back. 128 out of 132 legislators voted just 7 or 8 years ago to bring forward the GAB because the old system didn't work. And the last audit showed that it is effectively working. It's cited as a national model, so we hope they don't do it at all. If they were to do it, I think it would be highly questionable that you could effectively replace that before the next election. But we hope that they do things meaningful like this. This is what people care about. This is what people want, is for us to stop this kind of ridiculous, partisan, right-wing ideology and bring forward the issues that people care deeply about. People's lives are at stake. When they don't go to the hospital, when they don't go to their physicians to get preventative care, they end up in the emergency room with far more serious diseases and challenges. And so, the Pope Francis just left here. He taught us to care about our neighbors, care about our fellow citizens. This is one of the most significant things you can do to match what the Pope had to say during his visit here in America. Nothing else needs to be.
Well, yeah, no, I have one other. In terms of just the broader agenda, you've been asking for Republicans to sort of move a different direction on their agenda. What it would appear, though, in terms of GAB, John Doe, minimum markup, the Planned Parenthood fetal tissue bill, it seems like they're poised to move in a different direction from that, or in the same direction going forward.
They're stuck. They're stuck in the notion that the only thing that they feel that they were elected to do was to cater to the far right-wing ideological base of their party. And I think they just haven't reconciled the fact that it's not working. The governor, as we said, 0.5% popularity nationally. 39% approval rating. And at some point, I think they're going to suffer the consequences of continuing to do the same thing that is not working effectively here in Wisconsin. And whether you talk about jobs, which we're still way below the national average, whether you talk about infrastructure, I think we're quoted by some engineering group as having one of the worst, maybe it was second worst, third worst in the country. Whether you look at education, and we can see the impact of having teacher shortages and having fewer people going into teacher education across the spectrum. Their agenda is hurting Wisconsin. And the $250 billion they took out of the university, make no mistake about it, that is going to have devastating effects in terms of public-private partnerships, in terms of our competitiveness nationally and internationally. And so that's why I agree with you that unfortunately they still seem to be stuck in that same mode of bringing forward these far right-wing ideological changes. And but at some point, I think that if the citizens keep reminding them and keep calling their offices and organizations start demanding that they take responsible action and pass the people's agenda, what the people of this state want to see done. Things like Badger Care. Overwhelmingly. Everybody would like us to take this money. Virtually every group, most citizens, I hear from virtually nobody that says this would be a bad idea. So at some point, we're hoping that, the weight of all those calls, of all these petitions, of all these wonderful people that continually come here to tell them to do the right thing, will finally have that impact on them. If nothing else, maybe the drumbeat of the Marquette polls, poll after poll after poll, showing that they're on the wrong track, hopefully will have an impact.
Well, and I just want to follow up that, both the Assembly, I think last week rolled out their agenda as we go into the fall floor period. The Senate Democrats will be doing something next week in the real near future. I worry about this fall and next spring. We have a very narrow window, a very short time frame to do significant things in this state. And I don't want this fall to be a fall of missed opportunity. I wake up every morning and I feel like I'm living in the movie Groundhog's Day, that every week there's more harmful things that come on this agenda. And it seems really out of touch with what hardworking Wisconsin families think about at the dinner table. It seems very far overreaching as they look to, they control the governor's office, they control the Assembly, the Senate, they control the Chief Justice now of the Supreme Court. They want to be able to control the Government Accountability Board. They've got ideas to control the DPI superintendent. Enough is enough. They have this insatiable appetite for power, and they were overreaching. And I really think hardworking Wisconsinites are frustrated. They look to see what happens at the Dome, under the Dome every week on the news, and they're like, really? You guys are fighting about that? I'm worried about the potholes on the streets that I drive on every week keep getting worse, and my city council says, look, we don't have any resources from the state to fix these roads for the next 18 years. I'm worried about ever increasing class sizes for students in our public schools. I'm worried about the diminishing resources for the university system. I'm worried about anti-research attacks for our university system and what that means. Those are the things that literally when I go to the grocery store, that's what people stop and talk to me about. That's what people talk to me at the bus stop as I'm a bus stop mom for my 2 kids at the corner, and they're like, what's happening to our schools, Jen? What's happening with the expansion of voucher schools and diminishing resources for our own public schools? And it seems like this majority, they clearly have taken their eye off the ball. They clearly continue to listen to special interests and big campaign donors, and now that the governor is, welcome home, Governor Walker, welcome back, we have a lot of serious issues that people are getting increasingly frustrated about the stagnant desire to do anything real in this legislative body. If I sound frustrated, it's because I am. We all are. We are all frustrated that these things, nobody asked me about GAB, John Doe, anti-research efforts. They don't talk to me about these things. The idea that we don't have enough money in campaigns, we need more, that's not true. I mean, so I want to do something that's real. My Democratic colleagues and I, we want to do something that's real, and it's putting hardworking men and women back to work. It's making sure that people, when they want to retire, that they have security to their pension, that they've got some knowledge that pension is going to be there. They don't want to deal with the continued economic angst that they face in this state because we are stagnant on wages. We hear in GE cutting jobs there. I mean, these are serious things, and the things that my colleagues in the majority want to talk about, I just shake my head. Every week, I shake my head because it seems like they don't get it. It seems like they've taken their eye off the ball about what really matters in this state. And I don't care if you live on the shores of the Chequamegon Bay, to the banks of the Mississippi River, to the shore of Lake Michigan, to the Rock River. We all have a value in this state about what we want to talk about and the issues to move our state forward and stay competitive. And this has been a tough several years in Wisconsin, and I think we can do better, and I know we can do better. This starts the better right here. Access to health care for our friends, for our neighbors, for family members. This is what counts. Any other questions? It's National Coffee Day. I had a whole bunch today, can you tell? All right, thank you very much.
Thank you. Thanks,
We have a minority leader who can say